Hi, this is Dr. Jerry Catapang with IntegratedPAIN.TREATMENT.com. Thank you for tuning to our video blog today. We have a very interesting topic today. By the way, a couple of weeks ago, we launched our first video and answered the question, why are you in pain and why are you not getting any better? That's a tough question to answer. We were able to do that for you. And if you missed that video, click on the link below. We sent you the link so you can watch that video. And also, the video is posted on our website, www.integratedpaintreatment.com. Now, for today, we have a very interesting topic. A lot of patients are in a dilemma, when this happens, especially when the decision of having surgery or not becomes their decision. Yes, it can happen, wherein the surgeon would say, it's totally up to you whether to have or not to have surgery. So, most patients are stuck. They don't know what to do. That is very frustrating for us and, of course, very frustrating for you. So let me tell you this. There are three things that you can expect, after you see a surgeon. Of course, the first expectation would be surgery is indicated. You need to have surgery. This is when the surgeon would say, okay, Mary, you need to have surgery the next couple of days. We need to schedule you for surgery the next week, for example. When that happens, when the surgeon says so, it will be best for you to submit to the surgery if possible, because it means it's deemed necessary. It's indicated. It can be something severe that can affect your physical status, your functional status now and later on. For example, there can be, a severe impingement of the nerve in the, in the spine. There's a severe tear in your rotator cuff. So that means it's an indication. So when the surgeon says so, the decision is not going to be too hard. Do yourself a favor, submit to the surgery, if that's the case, but if you still would like to, check your options, there is, a discussion on that on the video link below. Why am I in pain and, why am I not getting any better? A consult with a physical medicine specialist. They help you in that decision. If you think you can still, defer surgery, you can see a physical medicine specialist, and this is described in the video link that we shared with you below. But anyway, it's one of the things that you can expect, when surgeon would say surgery is needed and we got to schedule it right away. Now, the second expectation is you don't need surgery. So great, right? But sometimes it becomes a little complicated, and this is not uncommon when patients would go see a surgeon. Surgeon would look at the MRI, for a minute or so, and the surgeon would say, Mark, sorry, there's nothing I can do for you. And then, leaves the room. And patients are stuck. What does he mean? But it's always misunderstood. But actually, let me share with you what it means, okay? So patients would come back to the clinic and say, Dr. Catapang, I saw the surgeon. I think my athletic career is over. I can no longer play professionally. That is so depressing. Or, high school students would say, my scholarship is over. I'm going to be able to play in college and get a scholarship. Or if they're in college, I'm going to be able to play in the NBA, NHL. So they take the information, in a different way. But basically, when a surgeon would say, there's nothing I can do for you, it only means celebrate. I always tell this to my patients, have a beer, have a good dinner, because what a surgeon would mean by that is surgery is not an indication and you don't need surgery. Because when you see a surgeon, those are the two things that he would like to find out. Can I do surgery on this patient? Is surgery an indication for the patient's problem? Those are the two things that he would consider. So when he said, there's nothing I can do for you, the surgeon only means you don't need surgery. Surgery is not an indication. So, hey, celebrate. Don't be depressed. You have hope. And we believe the hope is integrated pain treatment, the integrated pain treatment approach. So if you are not aware of what integrated pain treatment is yet, please, watch the video below so you can, learn it for yourself. In that way, you can return to function in sports at the earliest possible time. So that is the second expectation, which is surgery is not an indication. But if it's not indicated, there's still an approach, a good way for you to be able to detect the cause of your injury, but of course, seeing a surgeon, the first cause is already identified, which is there's a structural damage. And then what? What's next? What are the three other things that you need to be taken care of? In that way you can, return to sports and function at the earliest possible time. So this is the second expectation. Now, the most difficult question becomes very tough when the surgeon would say, Mike, it's totally up to you. You can have surgery or not to have surgery. Why? Because your condition is borderline. And that's a tough decision to make to most patients. And they're stuck. What am I going to do? I can't believe the surgeon is asking me whether I want to have surgery or not. I mean, he's not helping me. Well, he's going to help me if I need surgery, if I want to submit to surgery, but what if I don't want to have surgery? So there are two things that we can provide you, to answer that question. The first, advice that we can give you is answer this question. Am I functional with the very least pain? That's the question you need to ask yourself. Am I functional with the very least pain? So when we say functional, it means you can do your daily activities at work and your leisure activities with the very least pain. If the answer is yes, then, maybe you can defer or avoid surgery, temporarily, hopefully long-term, but if the answer is no, then you have to be functional. You have to perform your daily function, with the very least pain, with the very least tolerable pain. Because if the answer is no, then, the decision is going to be easier. Submit to surgery, okay? Now, if it's still borderline, there are times that you're okay functionally, there are times you're not, then the second advice that we would like to provide you is, learn about integrated pain treatment. Experience the integrated pain treatment of having 4 specialties taking care of you, for your problem after an injury. You need, the services, of course, of your primary care physician, your doctor of physical therapy, your physical medicine specialist, and, surgery if necessary. Those are the 4, medical providers involved in the integrated pain treatment approach. And this is so important for you to know and experience because, for you to recover quick and return to function quick, there are 4 things that need to be taken care of after an injury. You're going to know and detect if there's a structural damage, if there's an internal inflammation, if there is a mobility issue. This is so important. If there's a mobility issue in your spine and extremities, that will affect your function and your performance, that will result to pain, and of course, muscle weakness. If these 4 things are taken care of, then your recovery will be the best possible physical recovery. And of course, if that happens also, then if those 4 things are taken care of, then your decision whether to have surgery or not, would be much easier. So, those are the 2, possible answers, to your question, to have or not to have surgery. But of course, there's another question that you may have in your mind right now. If I submit to surgery, what will be my expectation? What will be my expectation from the result of the surgery? Would I recover 100%, 75%, 50%? What is my realistic expectation? We will be able to answer that for you. Actually, we're in the process of creating that video for you. We just don't have much time today, to discuss that. But, if you like, subscribe, and share this video, and go to our website, www.integratedpaintreatment.com, the answer to that question will be there. And of course, the next weeks, months, we're going to have hundreds of videos from not just from myself, but from different medical specialists that would provide you the the common answers to your common questions, with regards to your pain and your recovery from pain and injury. It will be on that website, integratedpaintreatment.com. And to give you a preview of our next video would be on having or not having a cortisone shot, to have or not to have a cortisone shot when in pain. That's a very interesting topic. A lot of patients are stuck with that question also. So we will be providing that answer for you in the next video that we will be sharing with you. So if you find this interesting and helpful, please like, share, and subscribe. And we're hoping to provide you with the best answers that we know. And we care for your recovery. We would like for you to be able to detect the cause of your pain and for you to return to function and sports at the earliest possible time with integrated pain treatment. So this is Dr. Jerry Catapang from St. Louis, Missouri. You have a wonderful day.